Vaccines have been a pillar of public health for decades, protecting our kids from serious and sometimes even life-threatening diseases. From the first shot in infancy to the boosters in adolescence going off to college, it is important that we understand the importance of vaccinations, the vaccine schedule, and how it was designed. On the next episode of Ask the Doc, I'm going to talk about vaccines and their importance and the scheduling that has been outlined for immunizations. On the next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, a show where we encourage you viewers to send in your questions and I can answer them for you in real time. I'm Dr. Scarlet Constant, and today I'm going to discuss vaccines and the immunization schedule and its importance. Here's our first question now, coming in from the YouTube channel. Harper says, "Hi, Dr. C. I'm a new mom and I'm pro-vaccine, but I'm concerned about how early in my baby's life she's getting these shots. I understand about things like whooping cough and measles, but why do tiny babies need a hepatitis B shot? Isn't that a sexually transmitted infection?" Well, Harper, hepatitis B can be transmitted in many different ways. It's actually a virus that is transmitted via bodily fluids. And the most common way to transmit hepatitis B is from mother to baby during the birthing process. That is the most common way that we have seen it transmitted. Other ways are, yes, sexual contact, sharing needles, blood exposure in the lab, touching a dirty needle accidentally. There are many different ways to transmit hepatitis B. And I just want you to remember that the time that the children get their vaccines, it doesn't necessarily mean we're trying to prevent that exact illness at the time. It just means that we want the infant or child to have full immunity before a certain age so that we don't have to worry about them getting the disease. For example, during the birthing phase, hepatitis B is given within the first 24 hours of life. This is because, like I mentioned before, you would actually transmit hepatitis B during the birthing process. The reason why they get the subsequent boosters early on in life, it's not because they might be exposed to Hep B again, because there's only one birthing process, and they obviously are not going to be exposed to a dirty needle or poke themselves accidentally, but you want them to get their boosters so they can establish full immunity so that you don't have to worry about it in the future. I hope that this helps, Harper. The next question is coming from the AllHealth TV app. Albert says, "How can parents prepare their children for getting vaccinated to reduce anxiety and discomfort?" That's an excellent question. And as a pediatrician, I appreciate it, Albert, because vaccine, I think that, well, first of all, the fact that we call them shots is anxiety provoking enough, right? They're vaccinations that we inject, but everybody knows them commonly as shots. So I think what happens is, as parents, we have a bit of anxiety because we know that our child is going to be in pain. We know that it's kind of a stressful process, and you have a big needle and you're going to inject your sweet, innocent little baby. So that anxiety is already transmitted to your child before you even arrive at the doctor's office. So my suggestion as a parent is to talk about vaccinations at home to your young child that actually understands. Explain the importance of vaccinations and explain that going to the doctor's office to get their immunizations is a positive process. It's a way to protect them. I tell my patients all of the time, I'm giving this to you because I care about you and I want to protect you and I want to keep you safe. And if you change it to a positive thing, then the children are actually less anxious about it and they're more receptive because they're not coming in feeling like they're walking into, like, off of a pier, or they're walking into the lion's den and they're about to receive their punishment. This is not a punishment. This is actually something that they should be proud that they're getting, and it's a benefit. Not everybody can get vaccines. Not every country can provide vaccines to their children and to their patients. So they should see it as a privilege that they get to come to their doctor is protecting them and giving them a special immunization that is going to keep them safe. And you can also tell them that you'll sit with them, that you receive them as well. And while it is a little bit painful, the pain goes away right away. Be honest with them. Let them know, rather than making them feel like it's some form of punishment. And might I add that as a pediatrician, I would appreciate it if parents didn't say, you better behave or the doctor's going to give you a shot. Hope that helps. So the next question is from Facebook. This is from Osvaldo. Hi, doctor. My young son got vaccinated on schedule and everything was good. Now they're telling me he needs booster shots. Can you explain that to me, please? What are booster shots and how do they work? Will he need boosters his whole life? Well, Osvaldo, I don't know how old your son is and which boosters they're requiring, but the initial vaccinations are given the first 6 months of life, age 2 month, 4 month, and 6 month. And then there's a set of vaccines given at 12 months. And after 12 months, the vaccines that he's receiving on schedule are booster vaccines. So what this means is that the early years of the first few months of life, they receive their initial vaccines in microdoses. But in order to establish lifetime immunity, the child needs booster doses of quite a few of the vaccines. And again, this is between ages 15 and 18 months up to 4 years of age. They receive boosters, and those booster vaccines will ensure lifetime immunity. The other round of boosters that we now have on the vaccination schedule are at 11 years of age and 16 years of age. And that is it. There are no other boosters that your child will need. They will be immune for life for all of the immunizations that they've received. If you guys have any questions or would like to submit anything and you don't remember how to do it, take a look down below.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, so we have a few more questions coming in. Let's take a look. This is a question from Janisha. Doctor, I know vaccines don't cause autism. They don't. But I still hear that from people. Why is that myth so prevalent? Can you straighten out the vaccine haters, please? Well, Janisha, unfortunately, that myth is so prevalent because there are new groups of people every couple of years that breathe life into that myth over and over. It is exactly that, a myth. There is no correlation between vaccine administration and autism. You are born with autism. It is a developmental disorder, and you cannot get a developmental disorder by receiving an immunization, a shot of a vitamin, or any other type of medication. You cannot induce a developmental disability. With that said, the problem is that in this day and age, we have a lot of information by various sources. We can read information wherever we want. We can access information by so many different means and so many different sources. And the importance is to vet these sources. As a parent, you are seeking information on how to raise your child or what to give your child or medical information for your child. You need to vet the sources. You need to make sure that you are receiving information that is from a accredited source, and then use that information to make educated decisions for your family. So some people do not vet their sources. They'll read anything that's in black and white, wherever they find it, and believe it. And unfortunately, that is how myths and lies and misinformation are spread. Here we have another question coming in. This is from Facebook, from Aida. Doctor, my daughter has gotten so many vaccines during her young life, and I'm fine with every single one of them, but she's not a baby anymore, and there's some controversy around the HPV vaccine. Can you explain what's going on about that? The doctor says it could prevent her from ever getting cervical cancer. Is that true? Well, Aida, yes, that is absolutely true. The HPV vaccine has been around for a very long time. It is FDA approved. It is absolutely safe in boys and girls ages 9 to 45, but we offer it at the 11-year-old checkup. The HPV vaccine is a vaccine that prevents against human papillomavirus, which is a virus that has many different strains, but the most common strains that we have found to cause genital warts and to cause cervical cancer, as well as anal rectal cancer and head and neck cancer, they have all been identified and formulated into a vaccine. So this vaccine is given in 2 doses, and it could prevent your child from getting HPV, and that HPV eventually getting complicated into cervical cancer, anal rectal cancer, head and neck cancer, or genital warts. Now, how are these things transmitted? Human papillomavirus is transmitted by physical contact, usually in the genital region is where the contact is. It has been stigmatized as a sexually transmitted disease or a sexually transmitted infection, and some parents feel that they don't need to address any infections that are caused by this route of transmission at 11 years of age, which I understand. But please understand, number one, you are not actually worried, or we're not stating that your child is actually active. And number two, you do not have to be active in order to transmit this virus. Like I said, it is by physical contact between in the genital region or any other part of the body. So you do want to prevent your children, or you want to immunize your children before there's any suspicion or any activity that's happening at all. You want to make sure that they are fully immunized. And in order to assure that they're fully immunized before activity begins, 11 years old seems like the right time to do it. This is a vaccine that is approved for males and females. And like I said, because either one can carry the virus, either one can transmit, and there are very severe complications if either gender gets this infection. And the last most important thing I think that I want to mention, it's very important to know, is that HPV, if you do not have the strains that cause genital warts, you can have HPV and never know. If you patients are not tested for HPV, they are not screened for HPV, and there aren't signs or symptoms, again, aside from the strains that cause genital warts, there is no way to know that you have HPV at all until there's a complication such as cancer. So it is very important to immunize your children and protect them against this virus. Looks like we have another question coming in. This question is from Gerald. Does my kid really need a flu shot every year? He hates needles. I don't like them much myself. So why should we subject him to that? Why not just let him get the flu and be done with it? Gerald, I get this question every flu season. So I'm going to tell you what I tell all of my patients. First of all, yes, your child does need the flu vaccine every year. And guess what? So do you. He hates needles. You need to talk to him about needles and explain to him that it's not a form of harming you. It's not a weapon. It is actually a way to give you an immunization that is important to keep him safe and keep him healthy. The reason why you want your child immunized against the flu is there are a couple of reasons for this. Number one, if and when he does get the flu, a different strain from someone in class, or maybe he dodged it a few times and his immune system was down and he finally caught the flu, his body will fight it so much better than had he not been vaccinated or immunized against the flu. Sometimes you have just one symptom alone and you get over it in 24 hours. It is so much better than suffering the 3 to 4 days of misery, headache, nasal congestion, high fever, not eating, vomiting, and myriad of symptoms that come with the flu. When you're immunized against the flu, you get over it a lot faster, you feel much better, and again, your body is that much more efficient in fighting it. Now, how is that compared to not being vaccinated? Receiving an immunization means that your body has almost a supersonic response to the disease. Because they received the immunization in a controlled environment and they received the antigen, the body creates so many antibodies that are not actually fighting at the moment because you don't have the disease. So you have all of these antibodies that are ready and they're waiting and they lie dormant so that if you actually get the disease, they just attack right away and fight it off. So this is almost like a supercharged response, which you'd rather have than not being immunized. So I do suggest that you get the flu vaccine every single year. And I know that it is a pain to have to get a shot every year, but truly it is much better than getting the flu naturally. Our next question is coming in, and that's from our allhealthtv.com from Ahuva. Hi, Dr. Constant. I'm not an anti-vaxxer, but I am a concerned mother who wants to know what the potential side effects are of certain vaccines and how common are adverse or even serious reactions. Well, Ahuba, that is a great question. Why don't we watch this video and then I'll address it afterwards.
Jack's mom and dad just brought him home from a checkup. Jack has some pain, redness, and swelling where he got his shots. All common reactions that will soon go away. His mom is using a cool, wet cloth to make him feel better. The doctor gave them some more tips for keeping Jack comfortable, like reducing any fever by giving a non-aspirin pain reliever. She also recommended giving Jack lots of liquid, as Jack may eat less than usual for the first 24 hours after vaccination. Jack's dad is reading over some information the doctors gave him, which explains other mild side effects Jack could experience over the next few days. Serious reactions to vaccines are very rare, but Jack's parents will call his doctor if they notice anything that concerns them. Sure, his parents become a little upset that Jack is uncomfortable after he gets the shots, but when they think about the risk of Jack becoming sick from any of the 14 vaccine-preventable diseases, they know it's worth it to protect him in the long run. Learn more about childhood immunizations. Visit cdc.gov/vaccine/parents or talk with your child's doctor.
Hi, Ahuva. So to answer your question, there are potential side effects with vaccine administration, absolutely, but serious reactions are very rare, as mentioned in the video. Usually coming out of the office, the child will have soreness and pain at the site of injection, and in some of the older kids, I see a lot of swelling, redness, and maybe even itching. There's a delayed reaction sometimes 2 or 3 days later where the area gets abnormally swollen and red and warm and itchy. But again, very simple home remedies will help that. Cool compresses, sometimes maybe a little bit of ointment to stop the itchiness, but that's as bad as it gets. The risk of getting the disease that the vaccine is preventing is far bigger than the benefit of actually just being immunized. So we really don't worry so much about the side effects as much as we worry about getting the actual disease. And I do think it's important to discuss this with your pediatrician before the vaccines. Every time I give a round of vaccines to my patients, I talk to them about the vaccines, I explain the risks and the benefits, and I explain some of the potential side effects that might occur. So always have a conversation with your pediatrician about it and make sure you're comfortable before giving the vaccines. Here comes our next question, and that is from Zoe. What's the big debate between combination vaccines versus individual vaccines? Are there some vaccines that shouldn't be combined with others? And if not, why? Okay, Zoe, well, it's an interesting question. Just to make it clear, physicians don't combine vaccines. We actually purchase them combined. So the companies know which proteins to put together in the same vaccine. They make one combo vaccine and they send it out to us. And so, yes, they absolutely can go together. The components are just fine. There's nothing unsafe about it. I think there's been concern with some people that are skeptical about vaccines. They feel that if a vaccine is preventing against more than one illness, maybe there's a preservative or a material in the combo vaccine that is harmful to the child. There has been some controversy about certain metals and preservatives and things that are not healthy for our children. But again, these are just concerns and rumors. This is not true. Our vaccines are healthy and safe for children. They have been tested. They do not have harmful metals or materials or preservatives that will harm your child. Now, the reason for the combination vaccine is very simple. It's convenience. Instead of coming to the doctor's office at 1 year of age and receiving 4 vaccines, we have been able to produce some combination vaccines and put them all together and get 2 shots instead of 4, or 3 shots instead of 5. So combination vaccines are purely for convenience. It's to help you and to help your child and just to have less pokes. But at the end of the day, you're getting the same vaccine, whether you have them all separate into a separate syringe or you purchase the combined vaccine. I hope that this helps. Just know that they are safe, and it is important to follow the ACIP vaccine schedule. Now we have another question coming in. This question is from Stavros. Hi, Doc. Would you mind giving us, a brief review of the immunization schedules when we should go to the doctor's office for shots? Sure, Stavros. So when you first come into the doctor's office, usually they should give you a vaccine schedule just to help you out and to help you plan basically your life around bringing your young one to the doctor's office pretty frequently. So basically immunizations are given starting as early as 6 weeks of age, but usually we call that the 2-month wellness visit. And that's just because at 2 months, there are some milestones that we start looking for, and we really want to evaluate your child at 2 months of age and make sure they're developmentally age appropriate. And at that time, we will take the moment to give the first round of immunizations. From then on, you have immunizations at 4 months, 6 months, 9 months, 12 months of age, 15 months of age, and 18 months of age. After 18 months of age, there's a nice little break. And then they come back again at the 4-year, well, you're coming again for your routine visits, but you get vaccines again at 4 years of age, and that's what we call our booster vaccines. So at the 4-year visit, they get 4 vaccinations, and they are all vaccinations that your child has received in the past. There's nothing new. These are just boosters, and those are the boosters that are going to confirm the lifetime immunity. But in the beginning, yes, you have 2, 4, 6, 9, 12, 15, and 18. And it is important when you leave the doctor's office to check out and make sure you ask when you need to make your follow-up appointment. This is very important. You know that you need to come back and get the second round of vaccines. So leave with that appointment so you can stay on track. It is very hard to track every single patient and call them and remind them when to come in. We try to tell you, the offices try to remind and call, but it's better to leave. If you have an infant and you know you're coming in for several rounds of vaccines, just leave the office with your next appointment. Okay, we have another question coming in. This question is from Theodore. Dr. Constant, my wife recently heard from her chiropractor sister that the COVID-19 pandemic has affected routine vaccination schedules for children. Is this true? Yes, Theodore. Unfortunately, this is true. I have seen personally after the pandemic that parents have what we have been calling commonly as vaccine fatigue. There is just so much press around the COVID-19 vaccine in particular, and so much doubt and, I think just mistrust between patients, physicians, the media, our government. I think there was just so much going on and so much mistrust that everybody just got really tired. And they don't want to hear about vaccines anymore. And whether or not they question the validity of the vaccine is a whole other topic. But just the fact that they have to come in and they have to get on this schedule, I think people have been really tired and they just don't want to hear about it. And for the most part, what I've seen is that they'll just get the vaccines that are needed to get their child into school so they don't have an issue at the school. But anything that's recommended, such as a COVID booster or maybe the annual flu vaccine or things that are not strongly recommended or required for school, they're a little reluctant to get. So yes, that has been going on, but I'm hoping that with advocacy and with a lot of education and a lot of confiding in your physician and a trusted source, that hopefully that fatigue will end and we'll get back on track. Thank you for your question. Looks like we have another one coming in. This question is from Miriam. My daughter just had a baby, and I'm concerned about the baby's 2-month visit, where she'll get 4 vaccines at once. Can we space those vaccines out a bit? Hi, Miriam. Well, don't be concerned. First of all, it depends on the pediatrician. They might have a combination vaccine, so that'll help. So instead of having 4, the child will have 2 injections. And then there is one vaccine called the rotavirus vaccine that's actually an oral immunization. And so they're little drops that the baby sucks on. So two injections and 1 set of drops. I wouldn't be worried. First of all, these are immunizations that are important in protecting your new granddaughter. So you shouldn't be concerned about that. And it is not too much. This schedule was created this way because we wanted to try to make sure that infants got all of the necessary prevention that they needed in their early years of life in order to protect them specifically during the toddler years. So it is important to get those, and spacing them out. There's no benefit to spacing them out. As a matter of fact, if you think about it, wouldn't you rather get 2 injections at once and forget about it than coming back into a doctor's office several times for several separate injections? You're causing more pain, more vaccine fear, more office visits, more exposure to a doctor's office where your child might get sick from another sick patient that's there, and all for no true benefit. So it's better to stick to the schedule. So I'd like to recap the importance of vaccines just so that everybody's on the same page. Vaccines are important because we really do want to protect your children from life-threatening diseases that they could actually get throughout their life. You want to immunize them early enough to establish full immunity so they don't have to worry about it in the future. We have a set schedule that was created for patients to follow because this is the schedule that makes the most sense. It captures kids at their most vulnerable time, and it makes it the most convenient for families and for physicians. And you want to talk to your children about immunizations and that they're protective, that they're not a punishment, they're not a form of harm. It's actually something that you're doing because you and your doctor care about them and want to protect them and keep them safe. And most importantly, we all want to protect our community. We are citizens of the world and we want to protect each other. And that's a message that should be repeated over and over. I hope that this helps. And thank you for watching Ask the Doc. I'll see you the next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.